Welcome, my name is Loes Bulle Smid and I'm working as a researcher at Winsheim University of Applied Sciences at the research group IT-Innovations in Healthcare. And I will present to you our study Telemonitoring for patients with chronic heart failure, a best practice for nurses. This study is performed together with the Saxion University of Applied Sciences, the ISALA Heart Center, and funded by ZonMW, the Dutch Organization for Health Research and Development. Telemonitoring can improve care for patients with chronic diseases. In the Netherlands, telemonitoring is used in patients with chronic heart failure and heart rehabilitation, also called heart care at a distance. Patients measure their blood pressure, pulse rates, and weight at home. The healthcare professionals, especially nurse specialists, in the hospital use this data to improve the dosage of medication and provide tailored information. Heart care at a distance makes it possible to give patients with a chronic illness control over a part of their treatment in their own home. Important to mention, in this study we worked together with a nurse specialist and a physician assistant. To avoid misunderstanding, we agreed to use the term professionals. So reading, hearing professionals in this study, in this presentation, means all types and education level of nurses working with patients with heart failure. The aim of this study is to support nurses in the development and implementation of heart care at a distance in their own clinical practice by providing practical tools. This aim will be reached by describing the good practice of telemonitoring in the ISALA Heart Center. Research shows professional experience barriers in the development and implementation of telemonitoring. Lessons learned in the good practice of ISALA Heart Center and development of tools are expected to support the professionals. This study was conducted in close collaboration with the professionals with the use of design thinking principles. The following methods were used, like walking interview, customer journey map, keeping a diary, context mapping, and affinity mapping. These methods were used to better understand the work and processes and needs of the professionals in using, developing, and implementing telemonitoring. In the walking interviews, we gathered information, and afterwards this information was collected and reflected with the professionals, the participants of our study. The patient journey was updated. We walked the patient journey together. Changes in the past year were adapted in the journey. For example, not to set up alarms anymore for high or low blood pressure or fast increase in weight. The method context mapping here is used by keeping a diary by the professionals and also ask them to write down 2 cases. This data is discussed in an online session with the use of Microsoft Teams and a Padlet due to COVID-19. And at last, affinity mapping was done together with the professionals, as you can see here in this picture. All data we gathered was coded and prepared by 2 researchers. This data is presented to the professionals. And as you can see here, the professionals structured the data in teams. Professionals became enthusiastic and were part of our research team, involving in the project and working with different methods during the session. Hands-on working and developing fits their interest. Input during the sessions and critical view on their own practice feels natural for them. For example, reflecting on their own diaries in the session is easier than answering questions or interview questions about their daily practice. Yeah? What have you done today is more difficult. These experiences result in a toolbox, the toolbox we present on the website. With this toolbox, professionals can develop their own telemonitoring practice using the templates, for example. Several tools were developed. First, we made some templates, also pre-filled templates for personas. To answer the question for the professional, who is my patient? A persona, writing a persona can be helpful. This template is developed to write the persona. For example, you can fill in a short lifeline of the patient, but also the mood, thoughts and worries, demographics, goals, wishes of you or the patient, and a quote that characterizes the patient. Also, a pre-filled customer journey map is developed. With this tool, the professional will get insight in their daily practice. What are the facilitators and barriers in the daily practice for the implementation of telemonitoring? And answering the question in this customer journey map, at what point can we introduce telemonitoring and how will this affect the patient journey? First, the interaction moments can be filled in, but also other stakeholders or thoughts and emotions of the patient at that moment, but also of the professionals, of course. And here you can see a complete filled template in Dutch, unfortunately. The following tool is a case description intended for intervision with colleagues. The question described on the site can be used for this intervision. For example, do you recognize a case like this? What would telemonitoring do for this patient? And will telemonitoring support this patient, the given lifestyle advice? Furthermore, we also describe the patient stories. This will give stakeholders an idea on how patients experience telemonitoring. And lastly, we developed an implementation advice in which the good practice of the ISLA is described as an example in the different phases of implementation, with information, tips and tricks for implementation, and in addition we gathered other implementation tool of several organizations that can be used in your own daily practice for the implementation of telemonitoring. The involved professionals are convinced by the idea the toolbox will be supportive for professionals. It seems to be important to challenge the professionals to think, work and collaborate in sessions. For implementation, it is important to include decision-making professionals in the development team. And maybe most important, the professionals need extra fixed time to attend the sessions, so free of patient appointments in their schedule. And some take-home message. Of course, you don't have to develop everything yourself. Make use of the knowledge of your colleagues. Try to not interview or making use of a questionnaire if it's not necessary. Professionals really enjoy to participate, think and work in a study or development of telemonitoring. And lastly, use the toolbox on www.verpleegkundigehartzorgopafstand.nl. You can make use of this link or the QR codes. And I want to say a special thank to our student, Anouk Jansen. She did a lot in the research team, but also in the development of the website. Do you have any questions?